Hello everyone, I'm Renee Mehrra and welcome to Your Health Matters, our innovative health series with experts providing their deep insights into critical public health issues so we can maintain good health. Today's show is on diabetes, which is a serious illness, and we want to create awareness on this issue because almost over 1.7 to 1.9 million people in the U.S. are diagnosed with diabetes every year. And the financial burden to the United States through diabetes and its complications is over 330 billion US dollars. So you can imagine the magnitude of this illness, and it's very important to catch it early. And today we're going to be talking to two renowned doctors going to tell us all about diabetes, the risk factors, the treatment, and prevention. Joining me is Dr. Ajay Lodha. He's a board-certified internist and past president of API, which is Association of American Physicians of Indian Origin, the largest ethnic organization in the United States. Dr. Lodha has been practicing in Flushing for over 25 years and is affiliated with Flushing Hospital Medical Center. Thank you so much for joining us. Dr. Vinay Kapoor, he's a board-certified endocrinologist specializing in diabetes and metabolism disorders. Dr. Kapoor is affiliated with Northwell and is a director of endocrinology at Flushing Hospital Medical Center. Thank you so much, gentlemen, for joining us today. And as I mentioned in my introduction, diabetes is a serious illness, and importantly, Indians, South Asians in the subgroup of Asian population in the United States have a very high prevalence of diabetes and very high hospitalization rates. So we are looking at diabetes, which could be genetic or it could be type 2. So first of all, let us hear from you, Dr. Kapoor. What happens when somebody says, the doctor tells them you are diabetic or you're pre-diabetic?
Thank you, Renee. So diabetes is a chronic multifactorial disease. There are so many reasons behind diabetes, but two main reasons are insulin deficiency and insulin resistance. By insulin resistance, I mean that your body does not respond to insulin like normal people. Now, other reasons are there, but I'm not going to go into details about them. One important thing I want to mention is it's very relevant to Asian Indian population. I trained at Downstate Medical Center, and the guy I trained was Dr. Harold Lebowitz, who did a huge study. He found out that people in Indian villages, only 5% have type 2 diabetes. As those people move into Bombay, Calcutta, and bigger cities, Delhi, the percentage of people who have diabetes goes to 8%.
So urbanization creates a problem?
Definitely. But as we move here, at least 12% people have type 2 diabetes. Okay.
So even acculturation is creating a problem.
Definitely.
Means, right? So which means that, is it the westernized diet?
It's the rich diet we have here.
Yes. Okay.
In India, when we were growing up, there wasn't that much meat, there wasn't that much food. Even in rich homes, okay, you only got moderate amount of food. But right now over here, everything is so inexpensive. So regardless of what social strata you belong to, you can have all kind of food you want to. Okay, our bodies are not meant for that. Okay? If you look at Indian population, they are skinny people, but they have big bellies. I'm not excluding myself. Okay.
So you're talking about like BMI indexes?
So if you look at the studies, they say BMI index should be different for Indian population,
Yes.
2% less than regular American Caucasians.
That's right.
Also the waist circumference. To make a diagnosis of metabolic syndrome in Americans, you have to have a waist circumference more than 40. But for Indians, it's 35 to 36, depending upon female or male.
So can you share with the viewers what body mass index or BMI really means?
Well, body mass index is a index of your weight to your height. Okay, and it's a very important index because it gives you, if you're overweight, underweight, average people, for men, 26 is a good number, but for Indian men, we recommend 24 or less. So it's important to know. It just gives you an idea where you stand as far as your body weight and height is concerned.
I see. So when somebody is pre-diabetic, what does that mean?
Hemoglobin A1C is an index of diabetes control because it gives you 3 months average of the sugars. Nowadays we can diagnose diabetes based on hemoglobin A1C. In normal, hemoglobin A1C is considered to be less than 5.6. Now 5.7 to 6.4 is considered pre-diabetes. 6.5 and onwards, you are diabetic. But I understand more than 35% of this population has pre-diabetes. And actually, in my own practice, I see almost every Indian in middle age group who comes here, they have pre-diabetes. So it's a lot more common in Indian population as opposed to Caucasian population.
We'll talk about the reasons a little later on, but Dr. Lodha, tell us, that's a big magnitude. We're talking about diabetes, 35% being pre-diabetic, and I believe like 12 to 17% have diabetes in this country, and Asian Indians have the highest prevalence. Share some more of these statistics. The idea is to create that awareness that, if you are pre-diabetic or you have diabetes, this is important for you to know.
Renee, that the question comes that why we all are talking about blood sugar nowadays.
Yes.
Okay, why it is so important? Why everybody is talking about diabetes, hemoglobin A1C? What is the reason behind that?
Yes.
So as I want to tell the viewers that it is the 7th leading cause of death.
Yes.
And the complications are very severe. It is also known as a slow and silent killer. Mm-hmm. And what happens that when the patients, like my Dr. Kapoor just mentioned, that they come in his practice, in my practice also, they come with the very high hemoglobin levels, and they come and they say, "Doctor, we are fine. There's nothing wrong with us." But they don't realize that if you don't treat them at that point, few years later or 5 or 10 years later, they can come into severe complication, which can lead to debility, quality of life, and also slow death, because diabetes affects almost every important organ of the body. And the reason diabetes we call it silent killer is slow killer and silent killer is because it affects mostly small vessels of the body, not the bigger vessels. So what happens that the complications of diabetes does not come that early and you realize it later. If you go from the head to toe, like diabetes is one of the most leading cause of stroke, okay, and it doesn't affect the major vessels. It affects the small vessels. You get small tiny strokes, and then it can lead to major affection. Same thing, it is one of the most leading cause of blindness. As you know, eyes are very small, and you have small vessels affecting the eyes. So every diabetic patient should have frequent eye examination with the ophthalmologist, because if they catch the eye problem early, then it can be treated, or it can be either going into blindness can be prevented up to some certain extent.
So hold your thoughts on that. This is very important that you're sharing with us the complications that arise from diabetes and early detection. That is very important. Early detection to delay the onslaught of diabetes, and if you're pre-diabetic, all this has to be brought out, and that's what we're doing in this show. So stay with us. When we come back, we're going to talk more about the complications and the risk factors in diabetes. Welcome back to Your Health Matters. We're talking to Dr. Ajay Lodha and Dr. Vinay Kapoor about 7th leading cause of death, which is diabetes, and the complications that arise from this illness. So, Dr. Lodha, you were talking earlier in the segment that the complications could be a lot, could be hypertension, cardiovascular disease, or renal failure. So let's go back on them.
Okay, so as we were talking that it affects every organ of the body. So we talk about the eyes. So my advice to my viewers is that when they have diabetes, they should have every yearly eye checkup. It's very important, because if you catch early the eye complications, then you can prevent the blindness. Okay, that is very important, because you have to understand one thing, that diabetes causes irreversible disease.
Yes.
Okay, you cannot, if you don't catch in time, you are blind.
So glaucoma.
You are blind, because of the diabetic pleuropathy, diabetic retinopathy. It affects the small vessels and can cause clotting of the vessels, and that can cause severe complications leading to blindness. Third organ, which is very important, let's come to talk to the heart, where diabetes affects the major and the small vessels both in the heart, and it's again one of the major cause of the heart attack. And one thing very interesting in diabetes, since it affects the minor vessels, sometimes even patients have chest pain and you cannot catch it with the normal stress test because it affects the small vessels, and if it is affecting the small vessels of the heart, then you cannot catch by the stress test. Okay, so in that case, if patient is suffering more with the chest pain, then I think even if stress is normal, that patient should go for angiogram.
That is important.
That is very important for viewers to know. Okay, then you comes to the kidneys, and as you know that if you if you don't control your blood sugar, it is one of the leading cause of the kidney failure, and once kidney starts affecting, okay, only God can help you. Okay, there is no way to turn back. So my advice is control your blood sugar, and that can prevent all these complications. Another one, you talk about the limbs.
Yeah.
As I told you that diabetic affects the small vessels.
Yes.
So you hear a lot of times people who have diabetes, they complain, oh, my feet are burning, okay, my fingers are getting numb,
Yes.
okay, and this is all because diabetes affects the nerves. So it is known as diabetic neuropathy. These nerves can affect all the small nerves or small digits of your body, and some patients also have diabetic affection of the stomach. Okay, they just complain of fullness of the stomach. You do all the tests, you don't find anything because it is affecting the small vessel, which is known as diabetic gastroparesis. Okay, again, diabetes can also affect the macrovessels, the large vessels of the extremities, and you see people can get necrosis, can get blood clotting of the vessels, and can further lead to gangrene and amputation. So my advice is that control of the blood sugar, so we can avoid all these complications, and we can prevent this dreaded disease, which is known as silent killer. Okay,
So the whole thing is to catch it early on. That is the most important point over here. And we don't want to scare our viewers because all these complications can create a lot of fear, but the best way is to catch it early on so you won't have all these issues. So Dr. Kapoor, can you let us know, how do we control diabetes?
Okay. Besides the diabetes control, by that I mean hemoglobin A1C control, the control of blood pressure and control of cholesterol is equally important. LDL should be definitely below 100 in diabetics, but in some high-risk patients, it should be less than 70. We have a lot of medications available to lower the cholesterol. Almost all my patients who have diabetes, they're on statins. Now, blood pressure control we mentioned before. Another thing I want to recommend to all diabetics, as the ADA recommends, is about 30 minutes of cardiovascular exercise at least 5 times a week. That's a must. Okay? I know many of our Indian population is not into it that much, but I think we have to encourage that. Diet, forget about the diet. Indian diet, okay, especially we go to these restaurants, all the Indians have these weekend parties, and it's the same food. All the curries full of fat. Okay, we're gonna have to change that style.
Yeah.
Don't we hear so often that, oh, that guy passed away, dropped dead? I hear it so many times. I've seen this happening to so many of my patients. I want that not to happen anymore. Okay.
So what do you do when you're in a restaurant, when you're going out, because it's so heavy in saturated fat and oils, and the lentils may be good, the vegetables may be good, the meat may be good, but it's all the oil and the fat that gets it.
So you have to still make healthy choices, because if I eat tandoori chicken, fish, I think we should eat more fish than anything else. Okay.
And what about vegetarians?
So vegetarian diet, you can also pick from that. Like there are 2 types of dals, dal maharani and dal tadka. I think dal tadka is probably a better choice because they only put a little oil in it,
Yes.
and you can tell the restaurant owner to put as little as possible.
Correct.
Similarly, at home, say if I make lamb curry, it's bad to begin with. Okay, what I'll do is I put my bowl in the freezer. All the fat comes on top. I remove it, throw in the garbage, and then mic it and then eat it. Thereby, you actually, same thing with chicken curry and all the vegetable curries too. By skimming off the fat, you're actually lowering the fat content of the, all these curries. They're delicious. They're very hard to control.
Well, Dr. Lodha and I are vegetarians,
Yes,
so
I
let's
will
talk about that.
vegetarian.
So,
let me talk about.
See, vegetarian diet is even in some ways, okay, bad for us. I'm not
So
saying
you're talking of this high
if it's-
carbohydrates.
if
right?
it's done the way it's being done in some times. So otherwise, it's a great diet. Okay, if you're gonna make a curry and put it 1 teaspoonful or 2 teaspoonful of canola oil or olive oil, I'm very happy with that.
Right.
Okay, if you're gonna
Or
have
maybe a little bit of ghee, that is
Yeah.
still not that bad.
It's
Little bit of
controversial.
in moderation. In moderation. would
In
you say?
moderation, it's supposed to be, the yoga people are recommending it now.
Yes.
It's a big thing in yoga, but I'm not convinced yet. It's still controversial. Okay, but
What about more protein, like chanas, for vegetarian
Definitely,
people,
you know.
beans, lentils,
regardless, 50% of the calories, according to ADA diet, should be coming from carbohydrates, 30% from the proteins, and 20% from the fats. But the good fats, olive oil, canola oil, okay? Not the ghee is controversial,
Yes.
okay? And a
But
lot
I
of
would say
Americans are
anything in
using it.
moderation would be fine. And no
Absolutely.
sugared beverages. We're talking of sodas, all this.
Soda's
that's a
gotta
no.
stop.
Yeah. it's
Soda's
out.
got to stop. And so for diabetics, they don't have to have juices. They can just have a fruit.
Yeah.
They're allowed 2 or 3 fruits a day. Okay? Make sure the belly doesn't get bigger.
So when we come back, we're going to be talking to Dr. Kapoor and Dr. Lodha about treatment for diabetes. Stay with us. We're talking to Dr. Ajay Lodha and Dr. Vinay Kapoor about diabetes. And Dr. Lodha, we were talking about the importance of exercise and good diet, healthy diet, nutritious diet. Also, alcohol consumption. That is very important to share with our viewers. That should not be too much, if at all somebody's drinking.
Yeah, alcohol, as I said, that, alcohol, I want to touch this subject because there's a lot of misconception regarding the alcohol. And we should understand that, alcohol is alcohol, whether it's beer, gin, scotch,
Right.
or wine, it's alcohol, okay? And every alcohol is sugar.
Yeah.
You cannot make alcohol without sugar, okay? So one has to be very careful, especially when you're diabetic, how much your alcohol consumption is. As per the literature, they say if you really have to drink, then 1 drink for a woman and 2 for a man. But definitely, you are just assume that if you are drinking a glass of wine, there's all sugar which is going in your body, which is increasing your calories as well as your sugar.
So better to avoid.
Better to avoid, definitely. And for our viewers, it is, we are living in the United States, and a lot of nutritionists,
Yes.
they are not familiar with our diet.
Yeah.
So a lot of people, a lot of patients in my practice, they ask what should be our normal diet should be. So my advice to them is that whenever you eat, don't consume too much at one portion. Make it divided portions so that you don't assume too much calories. Sugar don't go too high.
So small meals.
Small meals is better than getting too much meal at the same time. Like we eat chapati, 1 or 2 chapati with a small amount of rice, with lentils, and they should not be not deep fried.
And avoid the
Okay.
oil in the roti.
Avoid the oil. Ghee.
Maybe put a little bit of ghee on the roti, little bit.
Yeah, you're making
No
us,
parathas.
No, it doesn't-
No parathas. They're delicious.
no
though.
paratha,
Yeah.
absolutely no fried foods.
yeah, I have
Fried
not
foods
eaten
no.
since
Puris.
morning, so now you are making
So
my
no
appetite.
pakoras, samosas, these are very,
Well, you can have occasionally on special occasions, but not on a regular
but
basis.
not at every time.
We don't want to kill our people also. Listen,
Yes.
they let them enjoy some
Enjoy
healthy,
some life.
enjoy their life also. But try to avoid as much as possible. These are dangerous foods. That's what it's basically, okay. I just want to mention a very interesting fact also. As I am from Rajasthan, I am from desert area. So they just observed that in desert area, there are a lot of camels, and people there drink a lot of camel milk.
Right.
And what they found, that in those villages, they don't find a single diabetic patient. So they related that with camel milk, because this is the only exceptional thing which those people are having, which we don't see anywhere else. So some studies are being going on the camel milk, that does it really prevent the diabetes, because you don't see diabetes in those villages. Okay, and the milk what they drink is more camel milk. Okay, so this is just a very another interesting phenomenon, right? Really.
Yeah. They're probably doing some studies on that.
Yes, there are a lot of studies and research is going on this camel milk.
Right. So, Dr. Kapoor, tell us about these small little gadgets that you have.
So the gadgets are, I'll go over quickly. First want to speak about the treatment of diabetes.
Yes.
When I was doing my fellowship, there were only 2 drugs on the market. Now there are 10 different classes of drugs available. So we have so much available in our armamentarium that we can bring the sugars down beautifully. And by doing so, we can prevent the complications, as Dr. Lodha discussed before.
Right.
Okay. So we always start with metformin. Okay.
Yes.
Now we know Indians are very used to using supplements, and actually have studied a lot about those supplements, and there's so many benefits of those supplements also. And then there are so many other drugs which don't make you gain weight. They make you lose weight. Until now, everything made you gain weight. Eventually, more than half the patient with type 2 diabetes will go on insulin. Okay? And insulin can be given in various ways. When I was doing my fellowship, there were long needles, and you have to fill up from the pen and pinch it. It was a painful situation. But now there are pens, and the needles are so small that you feel nothing. So if your doctor tells you to use insulin, don't be scared. Okay? A lot of time we hear, oh, I don't want to go on insulin. My uncle went on insulin and he died 6 months later because he was given insulin too late. Right? So we have to look at the situation with the current knowledge. Okay? The insulin pumps, see, a lot of people are scared because the finger pricks are painful. Now, there are 2 machines available right now. One is this.
No finger prick?
No finger prick ever required. It's called Freesight Libre. You have a little thing, patch, you click it here, it stays there, and then you can start checking the sugar. Every time you want the sugar, you put it here.
Do you keep the patch always on?
Yeah, 10 days.
Okay,
It's small, it's very small. It looks bigger, but inside is very thin, just like a Band-Aid.
Okay.
You put it here and get the sugar. You can check it 24/7 if you want to.
Do you take a shower with the patch?
You can take a shower with the patch, nothing. Okay, only a filament goes in your body. The other one is Dexcom. It's stuff like this. This goes in the belly.
I see.
Okay, and if you have a smartphone, you carry a smartphone anytime you want. You check your sugar 24/7. It'll also give you, prompts if the sugar is dropping too low or going too high. So you can set those
So do you
parameters in
beep
there.
or some sort of a
It'll
warning?
beep.
Okay.
Okay. Now I don't want to miss this opportunity to tell you about the insulin pumps. Insulin pumps have increased a lot. It has improved a lot. That's what I meant to say. This pump is wireless pump. Okay, it's called Omnipod. You take this thing has insulin, this pod. You stick it here, and you control your insulin from this. Actually, we, fix the how much you're gonna get and how much you're not. Okay. So this is one pump. Now this pump is Medtronic's 670G. This is an amazing device, first ever in the history. It's a closed loop pump. So you get a pump, and you get a thing like this, which goes here. Okay, this has a tubing though. So this one tests the sugar 24/7, and this one actually gives you the insulin, and they communicate with each other. It's almost artificial pancreas. So non-stop, you keep on getting insulin. You ate something, sugar goes up, it's going to give you more insulin, bring it down. So it's great for type 1 diabetics and some type 2 diabetics who are on insulin 4 shots a day.
Right.
Okay, so these are amazing devices. It's so
And
much.
these are available in the doctor's endocrinologist's office?
Internists can do it also if they have knowledge of this thing. Okay,
And they're covered by insurance?
they're covered by insurance.
Most of the
depending-
insurance,
Most of
But
them?
like
this
commercial
stuff-
insurances.
I see.
But this stuff, Dr. Lodha can use in his office. Okay, all the internists can. So does Dexcom.
Right.
Okay,
So you said that you can put it on for 10 days?
every 10 days you change it.
And
It's
then
just
do
a
you
click.
come to the doctor to tell them?
No, you do it
no.
yourself.
Okay,
And when you come to the doctors, I can download this.
I see.
Okay, from this and get all the sugars for the last 3 months. Okay, I can say, oh my God, he was going 40 in the middle of the night. So I know I have to cut down the insulin,
Right.
right?
Well, Dr. Lodha, your final thoughts?
I just want to give little bit knowledge and stress to all the viewers that don't get scared of insulin. It's a much better medicine for treatment of diabetes than oral medicines, less side effects, less complications, and with all these new gadgets which are coming down, you can control sugar better. So when your doctor advises you that go on insulin, you should immediately go on insulin rather than thinking. And nowadays, the needles are so thin, they are almost painless. Okay, you can do it by yourself. You can check the sugar, and all the oral diabetic medications in the market. There's a flood of diabetic medication in the market. Before, as he said, there were only 2 or 3, but now we see like 10, 20 coming in the market. Every day we see a new medicine coming in the market. They all have side effects. But insulin is the medicine which has the least side effect and the great potential to treat. And
Well, I
prevent
also want to
complications.
add, there's inhaled insulin,
Yes.
which got a freezer. You carry a little thing with you, and before each meal, it goes through the lungs, get absorbed. So that's also available right now.
It's all new state-of-the-art technology that's come out. Thank you very much, Dr. Lodha and Dr. Kapoor. I think the biggest takeaway is to catch it early, catch diabetes early. If you're pre-diabetic, you better go to check it out with your doctor, your A1C levels, your blood sugar levels, and change your diet and continue to exercise so that you are healthy. And that was the biggest takeaway over here in this show. I'm Renee Mehrra. Thank you so much for watching Your Health Matters. Stay healthy, stay positive.
Thank you very much. Thank you for listening.
Thank you so much.